Hi everyone, my name is Vasiliki Gkofa and welcome back to our channel. Today I'm going to discuss about a new personality disorder that we have not yet covered. So this is the Dependent Personality Disorder, and I'm going to talk to you about the characteristics, the core features of someone with this personality disorder, the etiology behind the disorder, the attachment style, diagnosis, as well as treatment. As always, I'm also going to finish off by touching upon some movie recommendations, and hopefully you will find that exciting and enjoyable. So let's start. Well, I would say that in a nutshell, what characterizes an individual that is going to be diagnosed with dependent personality disorder is this need to feel needed. An individual with this personality disorder will find value in themselves by pleasing and taking care of others. What I also want to mention here is that actually someone that is being diagnosed with dependent personality disorder is also very likely to receive a diagnosis or portray some characteristics of other personality disorders that we've already covered. This is the histrionic personality disorder, or for instance, the avoidant personality disorder. So if you have not yet watched those videos, I would suggest that you go and watch them. So let's move on now to the core features of someone that does receive this diagnosis. Well, we have the motivational. This is the need for support and approval from others. We have the cognitive, which is the self-concept as powerful and ineffective. We have the affective, which is this ongoing, I would say, anxious feeling, that tendency to become anxious when they are left to be functioning autonomously, to be independent. And we also have the behavioral. This is when they use some self-presentation strategies in order to strengthen the ties with the caregiver. So those are the four core features of someone that would receive this diagnosis. So now let's move on to the etiology behind this disorder. As always, and as you're probably imagining, there is that nature and nurture side. So genetics, but also environment will play a role. Now, for the sake of this video, I would like us to touch upon the environmental factors, and I'm going to introduce just a few. One is culture. So some cultures, like for instance in the United States, individualism is more promoted, whereas other cultures, they're promoting more collectivism. Another factor, another environmental factor could be the parenting style. So it has been suggested that parents that are more strict, that are more overprotective, or for instance, individuals that are being raised in an environment that there's low cohesion, that independence is not promoted, and therefore they're not able to express what they would like so much, they're more likely to receive this diagnosis. Another reason, and probably you might not have thought of this, is a serious illness. So if someone has faced quite a serious illness when they were growing up, that might feed into that concept of learned helplessness, and the parent might also become overprotective. So maybe in that case, actually, the parent felt that they could not do anything else because their child was in that position, and therefore that parenting style was reinforced due to the circumstances. The last factor would be abuse. So it has been suggested that individuals that have been sexually abused when they were younger are more likely to develop this personality disorder. Now, it has been suggested that females are more likely to develop that personality disorder if they have been sexually abused. However, I do want to say here that that might be because men are less likely to disclose that they are dependent upon someone else. So actually, we need to take this with a pinch of salt, because I would say that overall abuse is an important factor when it comes to both genders. In 1996, Benjamin also discussed 4 different features of the pathogenic process of this disorder. So let's explore those. The first one is caring for the individual, and of course that does build trust. However, the second one would be continuing that nurturing after beyond, I would say, beyond what is developmentally appropriate. And that leads to the third feature, to the third stage in a way, which is more the internalized inadequacy, the poor self-concept. And that leads to the last one, the fourth one, which is more the submissive, so more around the dependency. So now let's move on to the attachment style. If we're going to view this through the lens of the attachment theory, then I would say that we would report it as an interaction with an anxious and fearful temperament with an insecure attachment. The caregiver is going to provide that reassurance and security that the individual is actually not able to create for themselves on their own. They would need that interpersonal support and that attention from the caregiver. And if they are deprived of that social affection, I would say that what tends to happen is that they will feel that discomfort, that anxiety, that depression. Now, when it comes to the diagnosis, according to the DSM-5, our diagnostic manual, the individual that will receive the diagnosis of dependent personality disorder will have, as we've already said, this excessive need to be taken care of, and that would lead to becoming submissive. And there's also this fear of separation. However, we also need to have 5 other symptoms out of the following that I will be mentioning in order to have that diagnosis. So let's explore a few. The individual will have this, I would say, anxiety of making a decision, and therefore they will always seek that advice from someone else. They will feel that they are not able to make a decision, and they will feel uncomfortable if they have to, so if they have to function on their own. And they will also want others to assume responsibility for major areas or major decisions of their lives. They also feel that they cannot or they shouldn't disagree with another person, because if they do, then that might lead to loss of that support, and they don't want that. And they might go towards excessive lengths to find that support. And when they do that, they might actually end up doing things that are quite unpleasant. There is this uncomfortable feeling of actually being left alone and taking care of themselves. And they are also preoccupied with that fear of being left alone to take care of themselves. And because of that, they will always try to seek the next relationship so that they will secure that form of security, that form of comfort, so that they know that there is someone else that they can depend upon. Now, when it comes to the treatment side of things, I would say that CBT, Cognitive Behavioral Therapy, has been proven quite effective. So within CBT, you're trying to actually challenge those maladaptive thoughts, and the goals within therapy would be to actually increase that independence, increase that self-esteem and self-confidence, so that they can understand that they can be independent and they don't have to depend upon others. So it has actually been shown from evidence results that indeed, if you do start CBT, functioning would be improved in a few weeks, in months sometimes. So I would say this is one area that you can explore with your therapist. Now, in the beginning of therapy, some dependency would be assumed, so the therapist might actually take that role. However, as you move on within therapy, then there is that shift and the individual will start having more responsibility, for instance, around their workload. Guided discovery, but also Socratic questioning might be quite beneficial, because by doing that, then you are ensuring that the client is starting to find those answers to some important questions on their own. Moving on now to the pharmacological side of things, I would say that unfortunately, we don't have enough evidence in order to suggest that that particular treatment would be the gold standard one. However, what I would say is that an individual that does receive this diagnosis is also very likely to display or to be diagnosed with depression or anxiety. Why is that? Well, I would say that anxiety is more linked to the fact that they are preoccupied with that fear, with that anxiety of being left alone, or with that anxiety that they need to make a decision on their own. And that depression, that depressed feelings might be more linked to the fact that, well, they might not have that support, or there might be an end to a relationship, and therefore they might feel a bit low and that they have lost that security blanket. So if that's the case, then antidepressants might be quite beneficial. So that's it for today, guys. Thank you very much for watching another video on our channel. So to finish off, as always, I'm going to give you a movie recommendation, and this is The Blue Velvet. So the character played by Isabella Rossellini is actually displaying a few characteristics that we have discussed here today. So maybe if you are interested and you would like to explore this personality disorder further, maybe you can watch that movie. Thank you very much, guys. Bye.